prostate cancer is one of the most common cancers that we find in Black males today. We are super excited here at Hope Fellowship Church to interview Dr. Irvin Robinson, who I've known for many years, he and his wife. I love them both. And Dr. Robinson, give us a little background on who you are and what you do.
Okay. I am a retired obstetrician gynecologist who migrated from New York City, where I had a private practice and did my training, to Palm Coast, Florida. Eventually ended up on the faculty at Bethune-Cookman University from really about 2010 to 2022.
Yeah.
Yeah, I had to have a hip replacement, and so I retired from there. One of the people that I met at a meeting before I left was a representative from Mayo Clinic, Jacksonville.
Okay. Mm-hmm.
And she approached me and asked if I would like to be a part of their community outreach.
Okay.
Because they're outreaching down here. Well, they go all the way to Brevard, really. From Putnam to Brevard is the catchment area. And I said, sure, I'd give it a try. So I am a board member of their cancer outreach.
Okay.
And that allows me to give talks. So people say, well, you're an obstetrician gynecologist. How come you're talking about prostate cancer?
Yeah.
I used to talk to my patients about the condition of their husband.
Absolutely.
And eventually, I acquired prostate cancer.
Okay.
In 2009, I was diagnosed.
Wow.
And underwent radiation therapy. And since then, I've made it my mission to make sure that I speak out and educate as many men as I can about prostate cancer.
So let me take it back just a little bit. Mm-hmm. The first question I want to ask you is, why are so many Black males afraid to go see the doctor when it comes to prostate cancer? Or getting their prostates checked. Why? We know why, but...
The hammer over their heads that I found to be my experience. Even today, Black men don't like a digital rectal exam.
Okay.
A digital rectal exam is when a finger has to be inserted in the rectum. Mm-hmm. Why? Because the prostate sits between your bladder and your rectum.
Right.
And it's easily felt if you go the rectal route.
Okay.
And that's important to distinguish its contour, shape, its thickness, whether it has nodularity on it, whether it's painful. Mm-hmm. And a lot of Black men say,
not doing it.
Nope. So my retort to that is, a finger in the rectum won't kill you.
Exactly.
Prostate cancer definitely will. And so that's the choice you have to make.
The biggest issue with prostate cancer is that it's very silent in the beginning. And then once you get into this various stages, that's when it wakes up like a sleeping giant.
And usually when it's detected then, you're talking about a stage 4, where it's metastasized and spread. Primary spread site is to the bones, but it can go to the lungs, it can go to the liver, it can go to all of them. And you don't want that because that's harder to treat. Can't cure it. But the object of importance, I think, to mention too, the C word used to be so depressing for people. When they got it, they thought life was over. That's the end of my life. That's no longer true because we got new methods of attacking cancer. And the primary reason that those methods work is if you detect the cancer early enough. So screening tests for prostate cancer.
The PSA test?
The PSA test, a simple blood test. Picks up protein material that the cancer cells secrete into the bloodstream. And so you can detect in an early way based on whether you measure free or total PSA.
So when should a man actually start getting PSA tests, which is a blood test? So when should they start getting those tests done?
Well, I'll give you some historical info about that, which includes all men. When I say all men, recently President Biden was diagnosed. So we're not just talking about black men. This disease usually showed up on an average of about age 65.
Okay.
So they relegated it to be an old man's disease.
Okay.
Therefore, testing for it early really wasn't recommended. Now, you know how insurance companies are now.
Absolutely.
So anything to keep them from putting out money, they would go for that. So they didn't do it. The test is specific, whether you're white, black, Asian, or other. And it was a test that pinpointed a lot of early cancers.
Okay.
Problem was, it was an overdiagnosis sometimes.
Okay.
And then here come the insurance companies again, because if you get diagnosis, even if it's wrong, you got to go through some other steps, which cost money. So there was a United States prevention, a government agency that came out in 2008 and said, well, I don't think we need to do PSA testing anymore. We got too many negatives. There was a long introspective study of the Veterans Administration from 2014 to 2019. And what it found was that prostate cancer was increasing every year during that period of time by 3%.
Wow.
So that argument, plus the Urological Society, made them reverse that and start to test again.
Is that when they changed the age to say when by the time you hit 50, you should be being tested for prostate cancer?
Influenced that change.
Okay.
With black men, they were the primary target for the change. So instead of 65, they said we'll do it at 50.
Okay.
However, the prostate cancer that black men get is more aggressive than what other races get.
So let's chat about that. Why do you feel like the prostate cancer for black men is more aggressive than it is? Is it because we're not part of the research studies? Is it because we're not part of if we're not part of the research study, we're definitely not part of the medication.
And that's where we're sitting right now.
Okay.
Because a part of what I say is to try to get more black men involved in the clinical trials. There are a host of clinical trials going on. The Mayo Clinic has a website you can go to, and you can see the list of trials related to prostate cancer. Almost every drug company that makes the chemotherapeutic meds, they have trials too.
And we have local companies here that also do clinical trials. I find that, there's a stigma thing about us doing research because of what happened back in the day. But we've got to stop that, because that's a historical curse that we got to break.
Yes.
And in order for us to thrive and continue to live, we've got to convince. I know it was hard for me to convince my husband to get a prostate exam, because when my husband turned 50, I told him, I said, it's very important that you get a prostate test. You need to have that exam done, not just the blood test, but you need to have the exam. So I explained to him what the exam was going to be like, and he was like, "Nah, I'm not doing that." And I said, "But you have to, because I can't tell if you have prostate cancer or not. Unless you want me to do the same digital exam, but I'm not going to be able to tell that, just by looking. You have to have that examination." So it took him 2 years. He finally did it at 52.
Okay.
And that was with his brother having a scare. So that's why he did it.
That's the other important piece related to black men. If you've got a first degree relative, father, uncle, brother, who've had that,
high risk,
you are extremely high risk to developing it. And so the Cancer Society reduced the age for black men with a positive history like that to 35.
Wow.
Okay.
Wow. Okay.
So 35 is a long way from 50. And opens up a wide area for detection.
Wow.
And hopefully it will be early detection in that window. The latest about that piece is related to the genetics of the disease.
Okay.
And what's also been found over the last 5 to 7 years, the women in the family, your sister, who may have had breast cancer, ovarian cancer, is also a signal that your risk factor is higher. So it's not just related to the males in the family,
Right.
the females too. And if you explain that to a lot of men, sometimes that helps.
Yeah. Yeah.
The downside is convincing them that the exam's not gonna hurt you.
Yeah.
The other important piece is there are more women urologists in the United States too.
Yeah.
And to have a woman,
They might be a little okay with it.
you know,
So tell us about when you were diagnosed with prostate cancer. Your wife is a midwife, advanced practice nurse. You are a physician. So when you were diagnosed, what did that feel like for you?
well,
With all the knowledge you have, what did that feel like for you?
there's an interesting factor involved when you talk about my wife and I. She was diagnosed with breast cancer.
Right.
I was diagnosed with prostate cancer in the same year. There were a few studies written about that.
Okay.
How spouses have ended up with cancer
At the same time.
Now, whatever that's
Wow.
related to, I don't know. I think that was done by a psychologist
Okay.
looking at the mental aspect
Okay.
of that. I had a previous problem before I retired.
Okay.
Before I left New York.
Okay.
I had benign prostatic hypertrophy.
Okay.
An enlargement of my prostate
Right.
gland. At
And you
that
were about what age?
I was in my 40s.
Okay.
And I
Wow, that's young.
assumed
Okay.
that was going to be cancer then.
Okay.
So I studied about it. My office partner, the man I shared the office with, was a urologist.
Okay.
And so he said, you may want to remove that if it continues to get larger, because I was beginning to have effects from it obstructing my urine outflow. I didn't do anything about that
Okay.
because the PSA was normal. It was a little elevated
Okay.
because I got prostatitis and get that from
Right,
the enlargement. And I take antibiotics and then repeat the test and it would go back down to the normal level.
Okay.
But I didn't do anything about it until I got to Florida.
Okay.
So in about 1995,
Okay.
the symptoms were so increased, your wife will say, I think you need to see about that.
Yeah.
But what's significant that men don't think about, when they go to the bathroom and you pass your urine in the toilet, it makes noise.
Absolutely. Let's talk about that a little bit. Let's talk about the noise that the urine makes. What's the normal noise that urine should make when a man goes to the bathroom versus the abnormal noise? That's what I'm listening to when my husband goes.
And that's a key point that I try to point out to women to listen to that. If you pour a glass of water in the toilet, it makes some noise. A strong urine stream makes the same equivalent amount of noise.
Okay.
However, if you've been obstructed,
Okay.
sometimes you can't hear the outflow, or it may come in drops
Like
or
a dribble.
spurts
Okay.
because it dribbles out.
And it may take it longer for
Definitely
it to
going to
come
be
out.
standing there longer
Okay.
to empty your bladder.
Wow.
So women notice all of that.
Absolutely.
She knows when you're winning, it used to come out in 2 minutes. Now you're taking 5 minutes.
Yeah.
Then you're not sitting on that toilet.
Wow.
What's going on? And that's an important sign that we men
Miss out on.
think about.
So what do you think will drive a man to the doctors, especially if their mate is educating them on the stream of the urine, the fact that they may pass blood in the urine, the fact that it might hurt when they urinate, or the fact that, you know, it might hurt at other times when they're encountering their spouses.
Yeah.
What do you think will drive that man to the doctors, even if he does it in secrecy from his partner? What will drive him to the
The
doctors?
primary thing that influences men about any type of disorder is pain.
Okay, pain.
Unfortunately, only a late stage may create the kind of pain that will drive you. You mentioned blood, so blood in the urine, blood in the semen. Those will get his attention too.
Yeah.
So blood sign, pain, and loss of erection. In fact, erectile dysfunction. Will definitely get a man's attention. Most relationships, however, women have the power
to get him there.
Yeah. Whether they do it nicely or whether they just pick him up, put him in the car, and take him.
Yeah.
And he'll go.
Right.
He'll fight all the way and argue, but he'll go.
So from a dietary standpoint, what can men do differently as far as their diets? Because again, we already know that it's historical. They're not going, especially our African-American men. So let's look at diet and exercise. What can men do differently that will hopefully either prevent the possibility of getting cancer of the prostate? What can they do?
Well, when you talk about prostate cancer specifically, there's some antioxidants that you find in vegetables and fruits. And you can look that up and read which ones. And you should make sure you include that in your diet. Lycopene that you find in watermelons and tomatoes is helpful too.
And green vegetables.
That color scheme that they talk about in nutrition.
The orange, the green, the red.
Try to have a mixture on your plate when you have a meal. However, historically, we've got a dietary input that involves a lot of barbecue. As a matter of fact, there's a study that's going on in Africa and in the United States through people that I worked with at Mayo, looking at cooked meats and barbecue in particular, because most black men like the meat well done, as opposed to not so well done, definitely not rare.
So what are they saying about that?
They're saying that the intense heat that can change the proteins in the meat may be related. So they're looking at that in Africa, they're looking at that here. And maybe that part of the diet we have to focus on too. Certainly things that causes weight gain and high cholesterol. Well, the American diet is beefy, and the American habit is to fry. So you've got the groundwork for making us succumb to the changes that can occur.
So we need more fruits, more vegetables. Beets is one good thing that I know for sure, because again, I have to make sure my husband stays as healthy as he can. And if I don't do the research myself or with my knowledge that I have and try to help him, he's not going to do it himself. Right? So I got to say this. Although you are a medical doctor and you have all the knowledge and information that you needed, what did it feel like though when you were diagnosed with prostate cancer? Wow. Did you feel like, okay, this is going to be the end for me, or I know that I can get chemo and radiation and I can continue to live? What did you feel like?
The first thought was spacing out. And the doctor was talking to me about the results, and this was after the biopsy.
And you're a physician.
Yeah. And this was after the biopsy. So you have to have a signature change in the PSA that will lead to perhaps the biopsies being done. And you need tissue to make a definitive cancer diagnosis. So that's why the biopsy is important. Because I had the tumor removed, it was like 7 centimeters from my prostate.
Wow.
And that was benign. I was home free.
Right.
So I thought, I'll never have another prostate problem as long as I live. However, that PSA test, which was a part of my annual physical every year.
So although you had the tumor removed, you still had to have a PSA every year?
I still checked PSA because I knew how important that was. And there's a certain belief in my mind that was that totally benign or
Was it some cancer in there?
did they miss it? So I had a psychological block about that. And that was a good thing because it made me pay attention to the PSA. So my PSA came back. The normal range is from 0 to 4. Mine came back like 5.2.
Wow. Within a year.
3. No, this is, I was diagnosed in 2009.
Okay.
I had that tumor out in 95.
Wow, okay.
So during that period of time, my PSAs were all good.
Normal.
And I didn't really see an incline.
But would you say that that was aggressive? Because you did a PSA the year before.
Yeah.
So now a year later, that's pretty aggressive.
That's why I spaced out.
Wow.
And you mentioned the things that you do think about when you hear that you have a cancer. Knowing how deadly cancers can be. So I had that range. I was thinking about my wife because she was under treatment.
Your boys.
She had a specific doctor who started her on one of the new therapies that involved direct injection into the breast tumor. So she was doing well, and I thought about her. Our last 2 kids, the boys that were in school, in high school, and Krista was playing football at Bethune. So I thought about that. I thought about my grandkids. And I thought about not being here anymore. Yeah. All the things I'm not going to be able to see.
What did you change? What did you honestly change through all of that once you were diagnosed? And what can you say to Black men to help them get tested and to help them to care?
Okay. The testing part is related to that blood test. Okay. And the exam. There's a new diagnostic test that has proven to be even more definitive for picking up early cancer changes. However, it involves a PET scan, which is an expensive test. That test is even better than PSA. But you got a wide range of men who may not have health insurance, may not have any coverage to pay for a scan. Yeah. A CT scan is, you're talking thousands of dollars. So that, although it's a better test, it eliminates the digital rectal. You don't really have to deal with that anymore, which is a game saver for us because it eliminates that fear factor that really is just built on myth.
So let's just talk about because we're trying to get them to the doctors. We're trying to get them in the know so what can we do and what can we say to Black men today and share the importance of getting tested for prostate cancer? Because a lot of them probably don't have insurance, or the insurance is not going to pay for that CT scan, because you already know in order to get a CT scan, you've got to have a probable reason to get the CT scan in order for the insurance to pay for it. So for them to pay
make it a diagnostic tool. Okay. But because of the cost, it's there, but it's not available to everybody. Absolutely. So you still have to depend on the DRE and the PSA. To young guys who are 30 and less, I talk about the importance of getting an annual physical for everything and making sure that a part of that physical is a PSA test. Right. Okay. Talk about the levels that to watch for and the fact that Black men, their level for what's considered normal may be right at that 4. Right. Whereas other races, they can get to the 4 and not be worried. Right. Their inclination is a little lower. But sometimes Black men have a higher initial PSA. No symptoms, no discomfort. Wow. Go get the first PSA at age 38. And it's 6. 4 or 6. Wow. Yeah. Wow. So it depends on the age. The exam, the physical exam, the PSA, if you're less than 35.
Okay.
They're doing the initial studies at 35 instead of 50 for us. So we don't have to worry about that part anymore. But then I focus on your family history.
Okay.
And I come from an era where you had to leave the room when they talked about family history.
Yeah. Yeah.
You know, this is not.
You can't talk about, yeah.
Yeah, you need to go play.
Yeah.
We got adult talk here.
So we want to make sure that men understand the word caution that we've used in healthcare so much. The caution word, a change in bowel and bladder habits, a sore that does not heal, unusual bowel and bladder sounds, or unusual urinary streams for men, tingling, numbness, pain,
any
those
blood
kind of
sign
things.
of any
Blood in your urine. That is so important. And we wanted to do this segment on men's health today because it is so important that we get the word out and that we try to make an impact on Black men and let them know how important it is for them to be around for their babies, their grandbabies, and so forth, because things are changing with healthcare. Things are changing within the hospital settings.
And I'm glad you mentioned that, because that's the third piece that I try to impress upon you. If you have grandkids and you've interacted with them, you know that that's a different experience than when you had your own kids. You want them to experience you as they grow.
Absolutely.
And you definitely going to eat them up as they grow. So that's the choice that you have, and it's about longevity. If you detect the disease early enough, the 5-year survival rate, if you treat it in stage 1 or maybe 1.5, your 5-year survival rate is about 90%.
Awesome.
So you're going to beat at least 5 more years in your life, but that's just the baseline. You're going to live long enough for something else to take you out.
And the greatest thing is you're a living witness because you're past that 5-year.
Oh, yeah.
Right. So you're a living witness. But you're a living witness because you were proactive in what you needed to do.
And I'm biased because I know about cancers and definitely know about this particular one. So I'm biased, but that doesn't mean what I say can't help influence somebody who has no clue about how important it is. The other thing about males is we got this macho thing.
Yeah.
I don't even get a cold.
Yeah.
And when
I'm not going to get sick.
I sneeze once and it's over.
Yeah.
No. You need to be more concerned about yourself.
Right.
And if not for you,
for your family.
For your family.
For your family.
You play an important role in the family, whether you realize it or not.
Yeah.
And people want you there. And for you not to take care of yourself reduces the chance that you're going to be there for a long time.
What 2 things would you say to men today to help them feel more comfortable and more confident and to actually decrease their little macho-ness to make them aware that this is important? What 2 things would you say to the public today in regard, especially men?
I try to find out what their interests are.
Okay.
And what they really like to participate in and be a part of.
Okay.
And mention that, if you die from this disease, that's gone. That's over. And if having a blood test is the doorway to a long future, to me, that's a no-brainer.
Absolutely.
And then I challenge them, well, even if you just do it once, do me a favor, go get a PSA one time.
One time.
Okay?
Yeah.
Knowing that the results of that PSA is going to govern how they feel for the rest of their lives. If it's negative, then the fear is gone.
Right.
Well, go get one next year, too.
Wow.
If it's positive, you can start an early treatment if you caught the cancer early enough. If you don't go, chances are, if it's a focus of cancer in the prostate, it will show up when your bones begin to hurt so bad that you don't know what's going on.
Well, man, thank you, Dr. Robinson, so much. Man, you heard it from Dr. Irvin Robinson. Go get your PSA test.
Please.
Watch and pay attention to your urinary stream when you're going to the bathroom. And whatever you love the most, live for that. Thank you so much for being here. And
thank you for having me.
we appreciate you.
I appreciate being here.